All righty. So what was funny is Rita and Ritesh have both joined virtual sessions over the last couple of years. I didn't know they had actually never met each other. So we were out in the, I just assumed you two go way back, the new normal of conferences. So they keep us pretty tight on time. So we're gonna like jump right in. Very brief introductions, Ritesh.
Yes, I'm Ritesh, and this is my post-COVID hair, as opposed to the picture. I've just joined Finn after 7 years at Ogilvy.
This is a good look, by the way, Ritesh.
Thank you.
Rita.
I'm Rita McGrath. I'm a professor at Columbia Business School and have been working with Drew for some time now.
Some time, yeah. And so I'm Drew Ianni, really quick, founder GM of CDX, and we focus on digital business transformation and part of the Techonomy and Clarum family. So let's jump right in. Rita, I wanted to start with you because when we have these conversations, we always kind of start with you, a little bit of an overview. You're focusing on strategy and innovation. Obviously, you work with a lot of the companies across the sort of broader health industrial care, you know, the complex, I call it, right? It's like the military industrial complex, I suppose, but different. What's top of mind for you right now? I mean, obviously it's a very interesting time. A lot of us talking out there, like, is this going to be the last conference for a little while? You know, what's top of mind for you, particularly in regards to how the broader industry is responding to COVID, the patient experience, which is what we want to talk a lot about. But what's top of mind for you right now?
Well, I think a lot of the taken for granted assumptions about healthcare delivery have really been cast into question. And one of the ones that I think is most interesting is how digital is making its way into healthcare. And so if you think about the different players in healthcare, pharma companies, for example, it's all about the pill, right? And yet, or the pill or the treatment or the infusion or whatever the thing is they're delivering, and they're not really looking at the total patient experience, which I think is being massively changed by digital, by telehealth, by, you know, if you can't get together in person, how do you deliver healthcare? It's a very interesting question. So I think a lot of the incumbent players are going to be caught by surprise by how much behavior on the part of all players is going to change.
Right. And, you know, in terms of the patient, you know, you do a lot of research as well. With COVID, do you have any sort of evidence or research that you've seen that is highlighting exactly how the patient, us as patients, are changing as it relates to COVID in terms of, you know, whether we want to go see the doctor, whether we do telehealth, in terms of, you know, and how companies want to innovate to address that real fundamental change in behavior? How are we changing?
Well, I think one of the things that patients are beginning to do is assert for themselves more aggressively than they have before. So if you take hashtag not wasting time, something like that. No time for change. There's a group of diabetic patients who are basically tasking the industry with taking more aggressive action to treat their particular conditions. And so I think you're starting to see a couple of things. So one is the emergence of digital solutions that are devoted to specific conditions. So if you look at, just as an example, there's an app called Cove, which is all about migraine sufferers. And if you take a typical general practitioner's practice, migraine sufferers is like, what, 2-3% of the whole practice. So there's no incentive for them to get deep in treating those patients. Whereas if you could aggregate all the migraine sufferers, you know, in the country and say, well, this is a dedicated site for you, there's professionals, there's whatnot. So I think we'll start to see a fragmentation along those lines. And then I think you're also seeing more activism on the part of patients saying, hey, you know, you guys are not delivering the solutions we need. Fundamental problem with healthcare in many cases is it's not about wellness, you know, it's about an interest in keeping people sick.
Right,
So
right.
that's kind of a disconnect.
Well, and that was the question. We talked, so look at the four core components: payer, provider, the healthcare systems, and the PBMs. You know, three of those four, at a very minimum, have a core vested interest in us being sick, not us being healthy. So you work a lot with C-suite and the chief executives and the boards of a lot of these companies. So how do we incentivize them to actually want to fundamentally change their business?
Well, the big problem, I think, is that you don't have a systemic situation. So if you were in a case where I save money over here and that actually, you know, I change something over here and that saves money over there, a lot of times in healthcare, you save money in one place, but it actually costs you in another. So an example of that is Intermountain Health made a big push to address premature delivery of babies. And it cost them something like $300,000 the year that that was implemented. Better healthcare, better outcomes, better mothers, better babies, and it cost them money to do that very good thing. So I think you need a systemic alignment of incentives.
Ritesh, you focus a lot on the innovation front. A lot of these companies have open innovation efforts in labs and are really trying to transform the patient experience. And I know today we're probably going to talk a lot about companies that aren't doing it well and the industry really needs to change. But I will say that I had to go through a series of just medical visits and tests, and Mount Sinai has done a really great job, I would say, with their Mount Sinai, the app that they give you and my chart. I was very skeptical because I sort of grew up on the digital app side of things, and it's like, this isn't going to be very good. But just in terms of test results, reminders about, your appointment. So I'll say Mount Sinai, from my own personal experience, is actually doing a pretty good job. But what are you seeing out there from an innovation perspective as it relates to the patient experience, Ritesh? Who's doing it well, and what's that balance between some of the incumbents doing it well, but as well as these very interesting startups which are all over the place?
Yeah, I mean, this probably take me 2 hours to answer that question, so I'll do it in
I don't think he's going to let you get away
3
with that.
seconds if we can, right? So you're right, Mount Sinai, all the health systems are calling this the digital front door, right? Because we're not leaving our houses. Our behavior is changing as humans, consumers. Who would have thought contactless would be a feature for a brand, right? Now it is. I'll deliver it to you. I'll make sure it's safe. So I think you were, as Barbara said, Rita said, you were forced to go digital in some of these things, which is what you're sort of experiencing. You had to do it. Part of it was law. The open data law says you have to give patients access to your data now, right? So a lot of people were playing around that. To answer your question on the innovation side, some of the some of the health systems, I think, are doing most innovative things. UCSF, Sutter decided to dump the MyChart and use the ADA app, which is out of Germany, as the app for you to integrate with your system. So on there, you get your symptom checkers, you get your prescriptions, you get access to telemedicine. So this whole concierge care thing is going everywhere. Yep. And I think most of the health systems will be doing that. And I think that's where the future is. The other area is areas where you can change the quality of care, the delivery of care, handheld ultrasounds. I just saw a portable dialysis machine and a portable MRI. Who would have thought you could get a portable MRI to come into your room as opposed to put on a gurney and shift it down to the basement to get your MRI done, right? So those kinds of things.
And how are the pharmaceutical, because a lot of the pharmaceutical companies, certainly Merck has their lab, Novartis has Biome globally, so they've certainly made investments in regards to open innovation and their labs and innovation centers and things like that. How are they progressing? Are they driving sort of innovation?
I have no
I suppose if
pharma.
anybody who wants us to stay sick more than anybody, I suppose it's pharma.
No, I don't think it's that. I just don't think there's a culture. Think about it, right? I make a molecule, I license the molecule, I make a pill, I make a couple of billion a month, right? And then along comes this digital therapeutic that will do migraine, but it's going to make 100 million, but I need to spend 20 million to do it. Not sure I'm going to go there. So there's no business model, I think, for pharma. They're still struggling with the business model of what can I do digitally. And there's innovation experiments going on everywhere, right? I think Merck did it very early on. Novartis is doing it with Bios. JLabs, look at what Melinda Ricks has done with JLabs,
absolutely.
Right?
Yeah, Johnson & Johnson, JLabs
exactly.
is great.
Exactly.
Rita, in terms of sort of driving this business model innovation, how are whether it's pharma or other industries, doesn't even have to be healthcare. What has been sort of the successful formula as it relates to the C-suite and the board, and then getting, as Ritesh says, impacting the culture? How are companies really driving business model innovation successfully, particularly the incumbents who have vested interests and a lot to lose in the status quo?
Well, a lot of them aren't. The evidence for longevity on the S&P 500 is pretty damning. I mean, the lifespan of companies is getting shorter. Competitive advantages are getting shorter. So I think the dilemma that a lot of these firms face is that their leaders are operators. They're people who execute against a proven business model. They don't really get the innovation process. They're not comfortable with it. They don't understand it. And then when an advantage is gone, in the case of pharma, the thing's gone off patent, or something new has come along to replace it. They're not good at transformation. That necessity to change your business. So the answer is most of the time it doesn't work. In the few cases where it does, I think what you have is leaders who really understand the existential nature of the threats. They're willing to make the commitment when things are still okay, when things are still going well, they're willing to make the commitment to change, to innovation, to new things. And they have the courage to stick with it. which a lot of them don't. You know, I mean, the vast majority really don't at this point. And I think that's something that we can change, and I think it would be beneficial to a whole lot of stakeholders if we did.
And this question is for both of you. Rita, I'll follow up to what you said, and then Ritesh, I'd like your perspective as well, because you see a slightly different side of the market. When you talk about, and we've talked about many times on our virtual and in-person conferences about companies not understanding how to innovate. So particularly for these larger incumbents, what is that process? Or if there's one thing that you could recommend to companies, particularly large ones, as it relates to this is how you innovate, this is what you're missing. What is the sort of common mistake? And how do they start? Is it really leadership at the C-suite, and then it comes down? Is it bottom up? Is it engaging your customers more? Is it sort of all the above? But it's like, we talk a lot about innovation theater, right? Particularly with the innovation labs, right? Is it just innovation theater, or is it real? How do they actually do it?
Well, I think it starts with your agenda as a leader, right? Is innovation or growth or whatever the new thing is it item number 1, 2, or 3? And if it's not item 1, 2, or 3, you're not serious. So I think that's the first one. I think the biggest barrier probably is fear. Fear of failure, fear of the unknown, fear of your board, fear of whatever. I'm always astonished in companies. It's always them, right? They won't let me. They won't do it. I've talked to C-suite people who are talking about them, and they mean the board. And I'm like, if you can't change it, who can? And so I think there's this unwillingness to take responsibility for the future, which I just see everywhere.
Ritesh, maybe same question, but maybe in the context of, who have you seen that's doing it well, and what are those consistent traits in terms of some of the companies, particularly larger ones, that you think are doing it well? And then we'll talk about startups in a minute.
I think the ones that are doing well is the don't create a center of excellence or a central innovation hub that's funded corporately, because then it's somebody else's problem, right? So try and make it so that you are encouraging it at country level, at region level. And I think the biome structure is really good in that fashion. And I think Vas has done a good job of setting up that if you want a biome in your country, you have to ask for it, you have to fund it, and then you have to make sure. The Novartis thing, yeah. So I think they've done a good job of that. But, it goes back to, I remember I was at CNS Summit 2 weeks ago in Boston, and there was a workshop around how can digital therapeutic companies partner with pharma? And I stood up and said, why? Just let them do what they do you what to do, and then maybe one day one of you will win. So I think part of that is that conversation is, what's the culture? Do we want to innovate, and do we want to change? And if we do, that's great. And that's what Novartis, I think, is doing really, really well.
Yeah. And again, I encourage the audience out there to ask questions. Anybody here has a question, please, raise your hand and I'll attempt to see you. So think about a question, because we're coming up on 5 minutes, and I want to be sure we answer your questions as well. Let's talk a little bit about the startup innovation space. There's a lot of, sort of exciting companies in this space. Where's the traction here? What companies are, sort of startups in health tech broadly seem to be having a real impact? And whether they're on their own and then eventually get acquired, who knows how it all goes. But Rita and Ritesh, both of you, but Rita, I'll start with you in terms of some interesting startups you're seeing out there with solutions.
Yeah, well, I think one of the interesting things is the barriers to entry have really come down. And that means a lot of entities that could never have the resources to cope with the sort of the FDA approval process and all that sort of thing, are now able to have an impact on healthcare, even if they're not going that traditional route. So Cove, I mentioned, there's a whole bunch of other digital startups which are really honing in on the fact that many conditions are not being treated very well because they're a small proportion of people that have them. So I think that decentralization and focus on specific conditions is a really interesting phenomenon.
You talked about an industry company called Moody, I think, when we were
talking. Oh,
yes.
Yeah. So there's a wonderful, yes, absolutely. So there's a wonderful startup based in the UK called Moody, which is founded by a woman, and it's all about hormones, female hormonal shifts. And unlike a lot of health tech that's aimed at women, it's not about pregnancy or those kind of conditions. It's much more about how can you manage your daily activity based on what's going on with the hormones in your body. I mean, this is something nobody wants to talk about, right? And you'd almost have to be a woman to name a company Moody.
Yeah, I think you'd have to be. Ritesh, any other interesting startups? That's a tough one to follow.
Yeah, it is a tough one to follow. I would say, if you look at it, where I sort of follow the money kind of thing, right? So last year it was all concierge care, telemedicine combined with your electronic health record, combined with access to prescriptions, all in one place, right? seems to me mental health is where it's going. Huge amount of money in behavior, mental health, helping you live well. There's a very interesting startup here in New York that's using voice-based solutions for, it's aimed at high school kids. It's your diary, but you talk, and there's an algorithm on the back. So you're sharing your thoughts to this thing, and it's like a chatbot, like a Wobot, which started about 4 years ago. And I am amazed how many kids have already adopted it, and it's just come out of beta. I think they've got probably 30, 40,000 kids on it already, which is
And then it
fascinating.
sort of transcribes it for them and keeps it as
and
a
keeps
diary.
your diary and reminds you, you put your Instagram picture on there, you know, all of those things. It's fascinating.
Interesting. Well, so we have just a couple minutes left. Any questions out here in the audience before I sort of get to my final question here? We've answered all their questions, which is always a good sign. So
Rita, we did well, obviously.
We talk about interesting startups and innovation. Okay, we're going into 2022. We don't, you know, here we are. We don't know what's going to happen. You know, what's on your radar for 2022? It could be an interesting technology. It could be voice you think is going to, you know, capture more share in terms of solutions. It could be, you know, this particular segment of the industry is going to wake up. But what's on your radar for next year, particularly in the context of COVID and this sort of patient experience? You know, maybe around just fundamental patient behavior and how we all are changing. It could be anything, but what's on your radar?
I think it's all around the data. I think, you know, the open data rules took effect really in April. We've got a bunch of startups that are looking at this. The EHR vendors have about 36 months to get their act together to make sure that they're making all of that
And
data
I apologize
available.
for interrupting you, Ritesh. Can you just give the audience just a very brief overview of sort of the open data laws and what was passed and what that means for us? I know 30 seconds or less in the open data laws.
Well, all it means is you now have access to your data, right? Before, if you wanted your data, you had to go through many hoops to get it, right? Those who are old like me would remember the CDs that you would have to get from your doctor if you moved from one place to another. And just to get that CD, you had to call 16 people, fill out 16 bits of paperwork, fax, you know, find a fax machine, that sort of thing. What that has done, the open data rule now says you now have access to your data and people can't stand in the way of you getting that data. And it was mainly the electronic health record system vendors who were standing in the way. So now that that is being opened up, I see a whole new set of entrepreneurs coming through, but also the hospitals, MyChart, for example, right? Who are now creating tools for you to now look at your data. And I think the person that most everybody underestimates in this is Apple. I think Apple will own the consumer because they've given me the capability to connect to my data now with HealthKit, ResearchKit, CareKit.
So all about the data next year. Rita,
Yep.
what's, you know, we're right at time here. So
Yeah.
what's top of mind for you as we enter 2022?
So just across industries, not just healthcare, but across industries, I really see value flowing from attributes of products and services to attributes of interactions. So kind of building on what Ritesh said, it's really about how we use this data to create value from interacting things.
No, that's great. Well, look, I hope I get to see you both in person sometime soon. Who knows? This
Santa Claus.
another new
We're
normal.
here. It's a miracle, right?
Another new normal. But thank you again for being brave today, coming and joining us.
Thanks for having us. Thank you.
And
Thanks,
a round of
Drew.
applause for Rita.
Thank
and
you
Ritesh.
all.
Thanks, guys.
Thank you.